Good evening, and welcome to my presentation on addiction counseling. According to the National Institute of Drugs and Alcohol, 11.5 million Americans struggled with substance use disorder in 2024. Of that number, only 3.45 million sought help for their addiction. These numbers are astronomical, but what these numbers do not show are the total number of Americans who were impacted by substance use, the families and friends of those struggling with addiction. These numbers show the critical need for more addiction counselors in this country. In my presentation today, I'm going to discuss what an addiction counselor does, the education and certification needed to be an addiction counselor, some of the environments that an addiction counselor may work in, and the key role that an addiction counselor can play in the lives of those affected by substance use. We will also provide you with more staggering statistics regarding addiction and overdose deaths in the U.S. So what is a substance use clinician? Well, an addiction counselor, also known as a substance use clinician, works with individuals struggling with substance use disorder to help them achieve abstinence through individual and group counseling, treatment planning, and support services. It is the job of the addiction counselor to perform the following tasks. First, we provide assessments. So the addiction counselor performs assessments to determine the severity of an individual's substance use and to decide the proper level of care for the individual. Then they perform treatment planning. So once a client has entered into treatment, the addiction counselor aids the individual struggling with addiction to develop a treatment plan which identifies goals to assist the individual to achieve long-term sobriety. These goals should be specific, measurable, achievable, relevant, and time-specific, also known as SMART goals. The counselor works with the client to develop these goals so that the client has more buy-in into their own treatment. Individual and group counseling. So the addiction counselor will provide one-on-one and group therapy to assist the client in exploring patterns of relapse, explore their addiction, and develop coping skills to deal with triggers in high-risk situations. Through individual and group counseling, the substance use clinician can also help build sober support networks. The addiction counselor also acts as a case manager, assisting the client in securing safe, affordable housing and continued services that will help maintain sobriety. In essence, the substance use clinician helps with a continuum of care that will make the client more successful in their recovery. Relapse prevention. To assist clients in maintaining their recovery, the addiction counselor needs to determine risks for relapse and assist the client in developing a prevention plan. Relapse prevention includes helping patients identify their triggers and often working with families to teach them effective ways to support their loved ones and cope with the addiction. Crisis intervention. So an addiction counselor provides added support to the client in times of crisis and relapse. The counselor works with the client to stabilize them and provide support and guidance that will assist the client in coping with situations and moving towards recovery. An addiction counselor can provide crisis intervention services in many settings, including residential treatment facilities, hospitals, emergency rooms, or community and mental health centers. Education and research. Educating clients, families, and the community about addiction, recovery, and prevention is a significant role of the addiction counselor. With the negative stigma surrounding addiction, providing education about addiction as a disease and the struggles that those suffering with addiction face is important to assisting communities to have a better understanding of addiction and how to support those who are struggling with addiction. Research is another significant role of the addiction counselor, which can help in developing prevention and treatment programs within communities. Addiction counselors may teach family members and friends about substance use disorder so that they may learn ways to support their loved ones throughout treatment and throughout their recovery. Addiction counselors may also put outreach programs together for communities to help people identify the signs of addiction and other problematic behaviors. Coordination of care. So, as I stated previously, an addiction counselor also acts as a case manager for their clients. So, in this role, the counselor assists clients in finding housing, mental health and substance use services, healthcare services, and any other services that will aid the client in sustaining their recovery. Without a comprehensive care plan, the chances of long-term recovery decrease as it becomes harder for the client to integrate back into society and deal with triggers and high-risk situations. As an addiction counselor, you will act as a bridge between your patient and the outside resources that will be vital to their recovery. Documentation and reporting. Another crucial role of the addiction counselor is documentation and reporting to agencies that license and fund organizations. This includes insurance companies. An important rule to remember as an addiction counselor is that if it is not documented, it did not happen. It is the job of the addiction counselor to maintain accurate records of clients' progress in treatment. Documentation is essential to helping addiction counselors, as well as patients and families, to track the progress of treatment and evaluate and refine treatment plans on an ongoing basis. In some cases, addiction counselors may also need to provide updates and progress reports to law enforcement, court systems, and DHS. Substance use clinicians may also be called to testify within a court setting, and therefore proper documentation is crucial in order to be able to advocate for our clients effectively. So, what is the importance of addiction counseling? So, to recognize the importance of an addiction counselor, you only need to look at the staggering statistics on substance use in this country. So, I'm going to provide you with some of those statistics so we can together look at why it is so important to be in the role of an addiction counselor. So, according to the CDC, between October 2023 and September 2024, there were about 87,000 overdose deaths in America. This is down from roughly 114,000 overdose deaths in the previous year. This is the lowest number of overdose deaths since June 2020. Overdose deaths continue to be the leading cause of death in the U.S. for people aged 18 to 44. This shows the significance of increased numbers of addiction professionals and treatment options. In 2023, nearly 60% of all Americans 12 and older reported using at least one substance in the past month. This includes tobacco products, including vaping, alcohol, and all illegal substances. In 2023, 10.2% of all Americans aged 12 and older were diagnosed with an alcohol use disorder. In 2023, roughly 27.3 million Americans 12 and older reportedly struggled with substance use disorder in the past year. Also in 2023, 7.5 million Americans aged 12 and older struggled with alcohol and drug use disorders simultaneously. In that same year, 134.7 million Americans were current alcohol users. Over 61 million participated in binge drinking in the last month, and nearly 29 million people met the criteria for alcohol use disorder. In 2023, marijuana was the most used illicit drug, with 61.8 million Americans reporting using marijuana in the last year, and over 19 million Americans met the criteria for marijuana use disorder. In 2023, 8.9 million Americans reported misusing opioid drugs in the past year. This reported misuse includes prescription painkillers and heroin. It was reported that roughly 828,000 people misuse prescriptions or illegally made fentanyl. In the 18 to 25-year-old bracket, we had the highest rate of substance use disorder in 2023. And 12 to 17-year-olds had the highest rates of tobacco use, including the use of vaping. The rate of substance use is increasing in Americans over the age of 40, with millions of American adults having a co-occurring mental health and substance use disorder, with only a small percentage receiving needed treatment. So what causes addiction? Well, there are several causes for a person's addiction. Genetics play a vital role in a person struggling with addiction. One's family history can significantly increase the risk of developing a substance use disorder, which suggests that there is a strong genetic component to addiction. There are certain genes that can influence how the body responds to addictive substances. The use of substances alters brain functioning, particularly the areas of the brain that are related to reward, motivation, and impulse control. The neural pathways are impacted, causing changes in neurotransmitters such as dopamine, which helps develop addiction. There are also psychological factors that influence substance use disorder. Mental health significantly impacts the use of substances. People with mental health disorders, whether diagnosed or undiagnosed, are at a greater risk of developing substance use disorder, usually to self-medicate and numb their feelings. There are also certain personality traits, such as impulsivity, risk-taking behaviors, and difficulty coping with stress, that increase a person's vulnerability to substance use. Trauma and stress also play a significant role in one's substance use. An individual who has experienced trauma, abuse, or chronic stress may turn to substances as a coping mechanism and a way to not feel their emotions. There are also environmental factors that contribute to substance use. If a person grows up in an environment where substance use was common, substance use may become normalized for that individual and increase the risk of experimental use, which can lead to addiction. Peer influence can also play a significant role in someone's turning to substances, especially with adolescents. Associating with people who use substances can significantly increase the chances of experimenting with and continued use of substances. This can be used to try to fit in with a particular group of friends or as a way to maintain friendships. Socioeconomic factors can also contribute to substance use. Poverty, lack of opportunities, and low-income communities can create stress and hopelessness that can increase one's vulnerability to addiction. For some cultures, substance use is normalized. Cultural and social norms that normalize and promote substance use can also increase the risk of substance use due to the lack of healthy recreational activities and social supports. Finally, easy access to substances in the community, schools, or at home can increase the risk of experimentation with drugs and substance use disorder. It is important to understand that addiction can be caused by a combination of these factors, which increases the risk for a person to develop a substance use disorder. Understanding these factors can increase one's understanding of the need for early intervention, prevention programs, and easy access to various treatment options. Without easy access to these services, the chances of decreasing the instances of substance use disorder in this country will decrease, and the statistics that we discussed earlier in this presentation will drastically increase. So what education and certification is required to be an addiction counselor? So Education and certification can vary from state to state. However, here in Maine, to become an addiction counselor, a person must have a certificate or associate's degree at minimum. Some states require a bachelor's level or even a master's level degree to be an addiction counselor. So in Maine, you may either be a certified alcohol and drug counselor, a CADC, or a licensed alcohol and drug counselor, an LADC. For either the CADC or the LADC, an individual must graduate from an accredited school and sit for and pass an exam given by the International Certification and Reciprocity Consortium, the ICNRC. Once a CADC has been attained, a person must work a minimum of 4,000 hours of supervised work experience before they can sit for their LADC exam. Once the person is LADC certified, the individual can then take a course to obtain their certified clinical supervisor license. So this is a CCS. Once the person has obtained a CCS, that person can supervise other addiction counselors, and they can actually run any sort of treatment facility. In Maine, anyone who has a CADC or an LADC must be supervised by a CCS. Anyone who holds a certification to be an addiction counselor must also complete continued education hours each year. The certification that you hold depends on how many continuing education credits you must have. Determines how many continued education credits you must have. These requirements, again, vary from state to state, and they differ depending on whether you hold the CADC, the LADC, and the CCS. So where can an addiction counselor work? Well, there are many environments where an addiction counselor can work and assist clients with various stages of addiction. So these include the following. So rehab facilities. There are several types of rehab facilities that an addiction counselor can work at. There are residential treatment facilities where the clients actually live in the facility for a period of time, anywhere from 1 month to 1 year here in the state of Maine. There are also outpatient treatment facilities where the client comes to the facility to receive their treatment, and then they leave and go back home at the end of treatment. In both residential and outpatient treatment facilities, the addiction counselor will provide both individual and group therapy. So an addiction counselor can also work in a hospital setting where a client may go to detox from substances before entering another treatment facility. So in this setting, the addiction counselor will perform assessments, monitor the detox process, and assist the client in finding other services for substance use treatment. Then we have private practice. So once a clinician in the state of Maine holds their LADC and their CCS, they may choose to have their own practice where they perform individual and group treatment on their own. In private practice, the addiction counselor may also offer family therapy to assist the entire family in healing from the individual's substance use disorder. Private practices are most often for those individuals who have mild substance use disorder, or for those who have already completed a longer treatment program at a higher level of care, and they just need that continued support to maintain their sobriety. And finally, an addiction counselor may also work at correction facilities. So they can work in jails and prisons to help provide treatment to those who are incarcerated and suffering with substance use disorder. What you will find within the prisons is that it's mostly just individual therapy. In some cases, mostly federal prisons, you will see groups and more intense treatment more often in your local jails, you'll find just some individual therapy, and then that case management role comes into play where they will help the client find treatment for when they leave incarceration. So, addiction counselors play a key role in an individual recovering from substance use disorder. With the staggering statistics of substance use in this country, the need for addiction counselors is more prevalent now than it has ever been. I hope the information in this presentation impacted you and has aided you in deciding to become an addiction counselor. You will be making a difference in the lives of so many people who desperately need a helping hand. Thank you.